So welcome everyone. Today in this video I'm going to talk about proper use of modifier 59 and modifier XU. XU means XE, XP, XX and XU. So when we have to use that particular modifier, in which situation, where to use and when to use, that everything we are going to discuss now. So let's get started. So guys, now definition of modifier 59. Modifier 59 is a distinct procedural services. Under certain circumstances, it may be necessary to indicate that a procedure or service was distinct or independent from other non-ENM evaluation and management services performed on the same day. Modifier 59 is used to identify procedure services other than ENM services that are not normally reported together but are appropriate under the circumstances. So documentation must support a different session, different procedure or surgery, different site or organ system, separate incision, excision, separate lesion or separate injury or area of injury in extensive injuries, not ordinary encounter or perform on the same day by the same individual. So guys, in previous slide we saw modifier 59 and distinct services. When to consider it is a distinct services, we define this modifier as follows. So guys, this is the specific modifier given for Medicare insurance. So if you learn the proper definition and if you understand the thing, what is the difference between all four modifiers, very easy to append the modifier instead of modifier 59. So guys, for all other insurance, we are using modifier 59. Medicare will accept this four modifier instead of modifier 59. So that we will learn what is the difference between all four. So XE means separate encounter, a service that is distinct because it is acquired during a separate encounter. So only use XE to describe the separate encounter on the same DOS. So guys, that service should be on same day, but it is acquired during different encounter. For example, patient came in morning and again he is coming on different encounter for same day. So like that, I will give example in next slide. But here you need to remember that what is XE. XE means separate encounter. E means encounter. Then second modifier is XS. XS is separate structure, a service that is distinct because it was performed on separate organ system, separate structure, body organ, whatever it is maybe, but it should be separate structure. So S means structure. And then third modifier is XP, separate practitioner, a service that is distinct because it was performed by different practitioner. And then fourth modifier is XU, unusual non-overlapping service. The use of service that is distinct because it does not overlap usual component of the main service. So guys, in the right hand side you can see X and in bracket EPSU. So it is common like EPSU. E means encounter, P means practitioner, S means structure, and U means unusual overlapping. So next we will see the examples. So guys, we have one example, appropriate and inappropriate use of these modifiers. So first modifier XE. So here you can see left hand side scenario, then modifier and reasoning and notes. So if you read scenario properly, then you will get surgery operative session, one surgery procedure at 9 a.m. and one at 6 p.m. The physical therapy session group therapy service CPT 97150 performed at 10 a.m. and therapeutic exercise, that CPT code is 97110, that perform on p.m. So in this case, we need to know that both services perform on same day but different encounter, because a time different is there. It's not perform on same encounter. So in this case, we need to add modifier XE. So we need to use modifier XE to distinguish between these two CPT codes. So the notes here you can see that should be separate encounter and it should be performed on same date of service. If it is a different date of service, then no use of modifier and there should be no any edit or conflict. So I hope understood. We will see next example for another modifier. So guys, another modifier XP. So left hand side you can see one scenario is given. So patient is seen by her OB-GYNEC during the exam. The doctor note an issue and request his partner, a neonatologist, examine the patient as well. The patient is under treatment for breast cancer. During her appointment, she is seen by two physicians in the practice, the medical oncologist and radiation oncologist. So here you can see there are two different providers and both having different specialties. So the important thing in that to append modifier XP, there should be the separate practitioner. Then, because the description of the modifier is distinct practitioner, so that means a separate practitioner should be there, and it should be performed on same date, may or may not be on same encounter, may or may not be different specialty, and both practitioners fall under same TIN number. So guys, this is the thing where we need to focus on. It should be perform on same day. There is no issue with any specialty related things, because here you can see may or may not be different specialties. So there should be different practitioners only, and that should be performed on same date of service. So guys, next modifier is XS. So you know what is XS? XS is a separate structure. So here you can see injection into tendon sheet elbow, and that CPT is 20550, and injection into tendon sheet but knee. Then CPT code will be 20550. So guys, both CPT codes are same because the injection into the tendon sheet, but the location is different. One is here you can see that first injection given to the elbow and another injection given to the knee. So the anatomical site or structure is different. So in this case we need to add modifier XS to separate to differentiate two CPTs, because if you are giving same CPTs twice, avoid a denial, so we need to add a distinct modifier to show what is the difference between two injections. So if you add excess modifier, that means the injection given on two different structure or two different anatomical site. Here you can see separate structure or organ, different anatomical site, and it is performed on same encounter. So guys, next modifier is XU. So here the scenario is a diagnostic procedure is performed based on finding, and therapeutic and surgical procedure is required on the same day. For example, diagnostic cardiac catheterization is followed by the medical necessary cardiac procedure. So guys, here you can see what they are mentioning, the therapeutic and surgical procedure is required on same day. So normally if the patient is coming for any surgery or any catheterization for therapeutic use on the same day, because of patients having any medical condition or medical necessary to perform any cardiac procedure, so in this case this both CPT codes we need to build together. So usually it is not billable together because of patient's medical condition or medical necessity. The physician perform cardiac procedure as well as a diagnostic cardiac catheterization on same day. So in this case we need to add modifier XU to distinguish between these two procedures. So that should be performed on same encounter by same practitioner and same anatomical site, structure and organ. So I'll show you one screenshot where you can see NCCI edit conflict also, because if you add these two procedure CPT codes in CCI edit tool, then you will get. So guys, here you can see NCCI edit, and I have entered 96374 and 96372 two CPT codes here. This is not cardiac catheterization, but I just given one example to show you what type of conflict you will get in your software if you add in NCCI edit conflict. So here you can see 96374 and 72, and below if you read the line, they mention code 96372 is a component of column 1 code 96374, but a modifier is allowed in order to differentiate between services provided within the appropriate modifier. Both codes will be reimbursed. If you add proper modifier, then both services will be reimbursed. So, so here in this case, we need to add modifier XU to column 2 code. Column 2 is 96372 2. This is a column 2 code here. So we need to add modifier XU to 96372, and then conflict or error edit that will not get again. As you know, this modifier is only applicable for Medicare payer, and if it is another payer like non-Medicare, then you can go with modifier 59.